So I'll just introduce myself. I'm Craig Settee. I'm the coordinator with the Indigenous Peoples Engagement and Research Council as part of CanSolve. And I also help with the Wabishki, Bizhiko, Skaanj learning pathway, and just want to welcome everybody to the third and last webinar for this webinar series called Skills for Indigenous Health Research in a Spirit of Reconciliation and Relationality. And we have Dr. Malcolm King joining us again to share some teachings with us and some learnings, and just a little bit about Malcolm. You might have heard if you were on the first and the second webinars as well. Dr. King is from the Mississaugas of the Credit First Nation. He's also scientific director at the Saskatchewan Centre for Patient-Oriented Research, and also a professor at the University of Saskatchewan in the Department of Community Health and Epidemiology. So again, we'll thank Dr. King for joining us, and I think we'll hand it over to Malcolm here to carry on with the rest of the webinar.
Thank you very much, Craig, and Annie, everyone. I'm speaking to you today from my office in Saskatoon at the University of Saskatchewan. Saskatoon is part of Treaty 6, which is Treaty 6 First Nation territory and homeland of the Métis. You can see from the little map here that represents southern Saskatchewan and Alberta that Treaty 6 actually extends across our provincial boundaries, and in fact our treaty areas do not follow the straight line boundaries that were established by the European settlers to Canada, but in fact follow much more normal boundaries. So for many years, I did live in Edmonton, also on Treaty 6 territory. So our question, and please leave a comment in the chat window, is which territory are you calling in from today? I'd like to say just another couple of words about the treaties, because we're talking about relationships a lot in today's seminar, and relationships to treaty are important for all of us, not for settlers and for Indigenous peoples alike. These are agreements. The treaties are agreements between nations, and they're still valid today. These agreements were agreements to share the land and to share stewardship of the lands and waters that were made between sovereign Indigenous nations and the Crown. And so they're very important, and we need to remember when wherever we are in treaty territories in Canada, that these treaties are still valid, and they represent the reasons why we're able to live in the territory where we are. Next slide, please. So this is the third of these three webinars. I've enjoyed giving the first two, and I hope you've gotten something out of them. The learning objectives went in these three L's: look, listen, and learn. And today's webinar will focus on acquiring skills to engage Indigenous peoples and communities in health research in the spirit of reconciliation. Next slide, please. So expanding on these goals, we'll spend quite a bit of time talking about context and relationality. We'll deal with understanding ceremony and its role in research. We'll talk a bit about navigating institutional barriers and challenges, and finish off with ideas and suggestions on finding resources and support. Next slide, please. So this is probably hard to see, and in a way that's okay. This is the Western model of research. There's in many ways not a unique model, but one thing about Western models is that they tend to be linear in nature. And they have their value, certainly, because they do provide a step-by-step process, a good one for a lot of purposes, on how to deal with research, from defining the problem, developing background hypothesis, design, collection of data, analysis, interpretation, and reporting. It's all laid out there in a linear consecutive manner. But it's important to remember that engagement of Indigenous communities just can't be selectively dropped into this model. And if you were to do that, really you need to drop it in at every stage, but it's better to reconsider the whole way of working with Indigenous communities in health research, that it has its own timelines, its own processes, protocols, challenges, and opportunities. Next slide, please. So we've introduced the two-row wampum belt, gushwenta, in our previous seminar, and we bring it back here rather than trying to develop a different kind of illustrative model for Indigenous health research, because there would be no single model that would fit. It's always going to be contextual. And so the two-row wampum belt actually gives some basic principles on how to develop and proceed with research relationships, as in many other relationships, that they're relationships. They're meant to be relationships between equal and parallel that represent equality in approaches between Indigenous and Western peoples. So they can be a useful model for discussing research processes and practices. Next slide. So contextualization is really critical, maybe the first critical thing that one needs to be aware of. Each community is unique in its traditions and practices, as well as its needs and expectations of research. What fits in central British Columbia will be very different than what fits in southern Ontario or in the far north. There's no one-size-fits-all approach to engaging with Indigenous peoples and their communities. So it's important to find a guide or intermediary to help contextualize the communities where you're planning to work. And we'll say more about this later. Next slide, please. There are several aspects of contextualization that we'd like to deal with in this seminar. And the first one, and this is a very worthwhile article to look up and read if you haven't done so already, Coulthard and Simpson. This particular article was presented just 4 years ago at a meeting on my home territory in Toronto, the Mississaugas of the Credit First Nation traditional territory that we share with Wendat and Haudenosaunee. They talk about grounded normativity, and it's an ethical framework that's provided by Indigenous place-based practices and associated forms of knowledge. It particularly emphasizes reciprocity and our relationship with place, which is really our relationship to the land itself, to the lands and waters that are part of that every Indigenous nation has a particular place that it associates with. Next slide, please. Further aspects of relationality are here in this slide, and they're outlined in another very valuable paper written by Gerlach just 2 years ago. Interpersonal relationships are a key foundation of Indigenous research paradigms. I encounter this very often in the work that Alexandra and I do with Indigenous communities here in Saskatchewan or back in British Columbia, where we did live, or in our home territories in Ontario. One really needs to start off with these interpersonal relationships. It's important to prioritize time for building relationships with community members and colleagues. One just can't go in and get started with the project. It doesn't work that way. And relationship building is actually effective because it provides a safe space to initiate dialogue with community members about research partnerships. These are very important. So the dialogue is a critical part of beginning any research project. Next slide, please. So we need to have open and honest conversations. And there's an excellent paper from 10 years ago by Ross et al. That talks about a bi-directional flow of knowledge. We need to really consider this. We may have all kinds of expertise with our PhDs and our scientific papers, but our community partners have all kinds of knowledge as well. And it really needs to be a bi-directional flow, as Ross put it, that'll help navigate the ethical obligations to academia and the relational obligations to communities. And the other aspect of it is to approach things with a sense of humility. Humility allows the researcher, one should use it actually to your advantage, because in some ways you come in as the expert, but in other ways you are also the learner. And if you come into the relationship with a sense of humility, the learning will be better and the relationship will be better. I like to point out sometimes that humility is one of the 7 grandfather teachings. Well, there are many other ways of approaching it, but it's the one that gets the least respect in Western ways of thinking. Next slide, please. So going on with relationality, relationality allows the equalization of researchers and participants' power. It reduces those imbalances that otherwise occur and too often have occurred in the past between researchers and community participants. Using plain language is really important. And so you shouldn't be surprised at the value of using plain language, even within academic circles. We all have our expertise and our jargon, and it isn't necessarily universal, even within an academic circle. You need to maintain flexibility in methodology and process. Just because something worked in one context, it may not be the best kind of methodology or process in another one. And it's important to prioritize participants' comfort and emotional safety over the research agenda. Don't let the research agenda dictate the overall agenda. You need to bring in these other aspects as well. Next slide, please. So knowledge keepers, and really the involvement of knowledge keepers and elders in research is right there in the ethics in the Tri-Council policy statement, chapter 9, but I'm emphasizing it here again. It's important to learn to move away from learning about Indigenous peoples and instead learn from them. The knowledge keepers in our communities are the equivalent of our professors in academia. They have a lot of knowledge about our communities, about our histories, about the way things work, and we need to learn from them in working with the communities to design research projects. And knowledge keepers and elders can play an important role, a critical role really, in this process. Next slide, please. So here's a slide from our own network, CanSolve CKD. Our network has been developing resources to foster meaningful relationships between researchers and knowledge keepers. The knowledge keepers' teachings have reflected 7 strands that support culturally safe partnerships in health research. I would encourage you to go to the CanSolve CKD network website and explore this further. Next slide, please. So further to involvement of knowledge keepers, there's a number of suggestions here on this slide. One is to acknowledge the history and demonstrate openness to another way of being. It's rare in a way that a community meeting doesn't somehow get into the history, because it's very frequent, the idea that you need to know where you've come from in order to know where you're going. And our histories are often very different from what we've learned or what we've been exposed to in our Western education. Ceremony is important. It's important to incorporate ceremony. I've been offered tobacco to give these webinars, but at the same time, I do offer tobacco when I go to a community or meet with Indigenous people to talk about research. It's a respectful way of beginning the conversation, of asking for that permission to talk and to share knowledge. You need to make your intentions clear. There's nothing worse than having a secret agenda. Be open about what you want to do, and your potential community partners will be open about their intentions. You need to consider how knowledge keepers' work can be compensated. Many, if not most, of our knowledge keepers don't have the kind of privileges that we in academia or the health system have, where we're paid for this kind of work. And so compensation is important. We need to honor the source of the teachings and knowledge and respect intellectual property rights. Much of the knowledge keepers' knowledge is held in trust and stewardship and passed on from knowledge keeper to knowledge keeper. A lot of it represents the intellectual property of the community. You need to understand knowledge keepers' different specialties and roles. There is no generic knowledge keeper. Every knowledge keeper has their strengths in terms of what they know and what they could bring to a project. And building trust and strengthening personal ties to fulfill commitments is really important. Let's go on to the next slide. So I've talked a little bit already about ceremony. Ceremony is really intricately involved in research. There's an excellent book written by Sean Wilson, a Cree man who lives in Australia. It was part of his PhD work, and it talks about research is ceremony. and it's an important part of Indigenous research methods that we all should be aware of. Research is not only ceremony. In a way, ceremony is part of research. And we have many different examples where ceremony becomes a part of the research. Ceremony adds to the research. Ceremony makes the research work so much better. And we need to pay attention to this as well. Next slide, please. So there's quite a number of examples where ceremony comes in. Certainly sharing circles are a research method, a method of gathering information that are common in Indigenous research. There are different kinds of sharing circles. There's small and large ones. Sometimes sharing circles take even more than a day, but there's an incredible value in allowing for the going around the circle, that each person has the voice. Sometimes one uses a feather or a stone or a talking stick, but respecting each participant in the sharing circle for what they would bring to it. There are sharings of traditional dances and songs. Generally, this works very well, sometimes between rounds of a sharing circle, certainly at the opening and at the end. Blanket ceremonies represent honoring people who make contributions and participate. Smudging is important. It's our way of cleansing our minds as well as the atmosphere of the room, and allowing us to think more clearly. And as I mentioned before, the tobacco offering in most of our territories is our way of connecting with the Creator. Next slide, please. So I'm going to ask Craig to take over here. This is Helen Robinson Settee, our lead for the Wabishki Bizhiko Skaanj learning pathway from CanSolve CKD. So Craig, I hope you can play the video now.
Yeah, for sure. We'll play it right now.
Hi, I'm Helen Robinson Settee, and I'm the lead for the learning pathway, Wabishki Bizhiko Skaanj. It's going to really help people to understand how to do research from an Indigenous perspective, how to understand who we are as Indigenous peoples, our history, and how some of these things impact research. So I feel really honored that CanSolve CKD Network has really embraced our ceremonies and our way of doing things. One of the ones that I want to share with you this afternoon is the pipe ceremony that we had. We had asked the IPRA group last year in October of 2017. They really felt that the pathway needed a name. And so we worked with Elder Dan Thomas in Winnipeg, and myself and Caroline Chartrand and Dr. Barry LaValle worked with Elder Dan, and we had a pipe ceremony in March of 2018. And the pipe ceremony is one of our sacred ceremonies where we seek answers, or we ask for healing from a spiritual perspective. So in our case, we'd asked him to give us a name, or to seek a name for us, and colors. And so at our meeting, we had the pipe ceremony, and the name was given to us, Wabishki Bizhiko Skaanj, which means white horse. And so it's going to be all of our responsibility to take care and to honor that name. And part of that is through a feast. So we had a feast just the other day to honor that name. All of these things will come to help us as we implement that learning pathway. And so, you know, we've started that journey, and I feel really honored to be able to help in the process with all of our partners to continue on that journey of the learning pathway.
Thank you, Greg and Helen. We really appreciate what you had to say. Let's go on with the next slide then. So further talking about ceremony, it's really an essential part of building relationships and trust, as well as honoring host communities. And I like what Helen had to say about the pipe ceremony that was an integral part of CANSOLVE CKD's relationships. So it's important to Indigenous health research in much the same way that ethics boards are important to the Western research paradigm. I might illustrate an example that I've encountered in my own research. So Alexander King and I have a research project with Sturgeon Lake First Nation, with Willie Ermine and Norma Rabinskin and others. And this project actually got started in a formal way, and it really was important that it started that way, with a sweat lodge ceremony and a pipe ceremony that was held on their territory. Elder Willie Ermine, as many of you would know, is a lodge keeper himself and a pipe holder. And by starting off the research project in that way, it really helped to cement that relationship and the trust with the community. Afterwards, then we can really get down to the rest of the business of the research. Next slide, please. So here's some more on research methods. There's some examples of culturally appropriate methods. There are many others that could be brought in, and there's a reference here in the Canadian Medical Association journal to these: symbol-based reflection, storytelling, conversational method. This is really important. We see this a lot, and it's a valuable way of collecting important data that it doesn't all have to be numbers. Mentioned sharing circles before. There's actually in two different ways of doing sharing circles. One can have sharing circles as a single event, sometimes with multiple rounds, but one can also use sharing circles in a sequential manner so that you bring back the same group from time to next time, say over a series of meetings. And each time the nature of the conversation changes, it gets deeper, more involved, and by the end of the period, you have a real trusting relationship, not just with the sharing circle, but in the sharing circle, that the people in the sharing circle themselves develop a very strong relationship. Photo voice is another important thing, putting pictures and relating what we see around us, what we record, to how we're thinking about things. Next slide, please. So here we can take a little break, and I'll turn it over to Craig as well. So which Indigenous research methodologies have you heard about or used? And please get online and type your answer in the chat window.
Yeah, that's a great great segue. We just wanted to see what people who are on the webinar have to say about any research methodologies that that you've used or encountered or have heard about. So just to let you know, we're also planning uh, an infographic to follow up with the webinar series. So some of the suggestions from these poll questions that we've had throughout the webinars will also help to guide our work with that infographic. So we look forward to your feedback on this question and others.
Okay, well, maybe we'll give people just another half a minute and then we can continue with our webinar.
That sounds great.
Okay, so now we're getting back to bringing research full circle. So these are the final stages of research in the linear model, the dissemination and next steps, but they're really part of a circle because the next steps always bring you back to the beginning as well. So the dissemination and follow-up are essential parts of the research process. And we can look to OCAP principles, ownership, control, access, and possession, that the First Nations Information Governance Council have developed for First Nations research, which emphasizes community ownership of knowledge. For Inuit and Métis have their own versions of principles for research. And at the heart of them, I think they're all emphasizing the ownership and control and the self-determination in research. We need to view our relationship with communities on that basis. Next slide, please. So there are a number of barriers to deal with in institutional barriers, timelines. The institutional processes and structures often do present obstacles. We have ethics processes in our institutions that aren't necessarily as compatible as they should be with our own community ethics processes. I think we're making a lot of progress in Canada around this. I certainly encourage ethics boards to respect community reviews, whether they're in the form of a band council resolution, a municipal resolution, or other types of documents like that. In the review of research. We need to get away from one-way agreements, one-sided agreements where the university or the academic unit has all the power. These things really need to be balanced. And again, I think I've seen some good progress made recently. Research accounting is always going to be a problem, but we need to work with our institutions to make the processes more open and more transparent. And again, ownership of intellectual property needs to respect community ownership rights. The timelines of Western research paradigm can also be restrictive. And I think I did mention at the beginning, I can emphasize it again. We as researchers need to be more aware that timelines to develop research projects with Indigenous communities can be longer than what we're otherwise used to. Next slide, please. So there's a number of places to look for support, and of course there's various resources, the granting councils, but these are an illustration of some non-academic online resources that includes social media, blogs, and YouTube. These will be made available through the publication of this webinar after today. Next slide, please. So if you're in universities, there are really good opportunities to look for support if you haven't already. Many of our universities do have knowledge keepers in residence or elders in residence. Almost all of our institutions have Indigenous student groups and other resources. There are some strong faculty representations in some of our universities, and fortunately these are growing. We have our mentorship and support networks across the country, but also look for opportunities to hire Indigenous students and researchers in your work. And this goes back to that idea of two-way learning or bi-directional learning. You'd be surprised at how much one can learn from your students and fellow researchers. It's not just all one way. Next slide, please. If you're not in an academic institution, if you're in a community, you can look for organizations. If you happen to be in one of our big urban centers, there are Indigenous health organizations in many of them, and a couple of examples that come to mind are in Winnipeg, the First Nations Health and Social Secretariat of Manitoba, in BC, in Vancouver, the First Nations Health Authority. There's also friendship centers and community organizations really all across the country, and there's a online connection that you can get to look at the native, the friendship centers, the National Association of Friendship Centers. Next slide. And actually, just to finish off, if you can go back one, Craig, if you're already in a First Nation community or in a Métis settlement or a northern village, then obviously you've probably already got a guide to get there. And if you haven't got one, there will be one available. My experience is that First Nations, Inuit, and Métis communities are interested in research and establishing relationships, as long as it's done in a good and respectful way. So there will be people in those communities that one can turn to. Next slide. So we're coming to the end of this webinar. This is the third of the series of 3. We first did look and then listen, and now we've done learn to acquire the skills to engage Indigenous peoples and communities in health research in the spirit of reconciliation. And the 4th L in the series is leading, and that is where you, as the webinar seekers, as the researchers wishing to engage, as community participants wishing to engage, can utilize the knowledge from these webinars in research cycles. And so I hope that you will do it. I hope that you've gained some knowledge from these webinars that will be useful to you in what you want to do. I'll just finish off with some acknowledgements. I want to thank very much Craig and Graham and Simone of CanSolve CKD, really the whole organization for hosting this. And then a special thanks again to Helen Robinson-Satie, our lead for the learning health pathway. So with that, I'll turn it over again to the last slide and an opportunity for some discussion. And the discussion question is, how will you use knowledge from the webinars in your own research activities? Some of it, I guess, is an opportunity for your own reflection, but please share your thoughts with us if you can. Craig?
Great. Yeah, that's just the last part, I guess, of the webinar series was that we wanted to ask participants how you might be able to lead with some of the learnings from these webinars and other other learnings that you picked up maybe from other webinars as well, because I know I've participated in a few others in addition to these ones here with Dr. King. So we just wanted to start a little discussion and ask people, you know, what kind of stood out for you and how would you use it?
All of these webinars will be available online at the CanSolve CKD website. And there's a number of important references, particularly in this last webinar, that I would encourage you to download and read if you haven't already done so. They're really valuable resources, and by all means, please get in touch with us in future, and we'd be happy to hear from you.
Yeah, thanks, Malcolm. That's a great point to follow up with. Yeah, all of you who've registered, we will obviously send out the recordings from this webinar and the other previous two webinars. And we'll also follow up with the infographic at a later date. But I think we also have some questions coming in, which is a good prompt for me to look at here. So we have a question that is asking Malcolm, how do you get researchers off their research agenda and to include Indigenous folks to participate?
That's a really good question, and in a way, there's no stock answer except to take you back to developing relationships. I've seen this happen in various ways. I can give you an example of a colleague, a non-Indigenous expert in chronic disease, with whom I worked on a community meeting on the topic that they were interested in. And the first day, it was a 2-day meeting, we did manage to get, because of relationships, a number of Indigenous people from different communities. But my colleague was at that point not yet convinced of Indigenous research approaches. And so the agenda was really set up in a Western kind of way with particular questions, and the uh, the dialogue really was probably not all that useful. It was important to this colleague that for that first day we stick to the agenda, and that the agenda was limited to really dealing with that particular chronic disease entity that they were interested in. Anyway, at the end of day one, we met and we decided to change the agenda for day two and to remove the restrictions on what could be talked about. And by the end of day two, the dialogue had turned much broader than the chronic disease that it started out. It ended up talking about mental health and wellness, suicide prevention, the underlying causes, determinants of health and disease, the colonial history of Canada, all of the things that were really important to the community that would otherwise have been barriers to establishing a relationship around this specific topic of interest. I hope that helps.
Yeah, that's great. Thank you for that example.
I was trying not to identify any individuals in that, but the principle is there.
Great. I have another question that came in that's asking, can you please provide an example or a paper of how symbol-based reflection is used as a culturally appropriate research method?
We will do so. I don't have one right directly in front of me, but I'll work with Craig and Graham and Simone to get an appropriate reference as part of the online material.
Great. That's maybe a good prompt for also considering for the infographic.
Mm-hmm. Yeah, thanks.
So I don't know if anybody else on the participants have any other questions. Nothing else has come in, but I'll maybe give another minute for people to think of any questions.
We thought it was best to separate these three webinars into three sections. We could have done it all probably in a 1-2 hour meeting, but it's certainly not how I absorb things well, and hopefully it's been better for everyone to have three shorter webinars instead of one long one. Certainly in my own teaching, some of this material is based on teaching that I've developed along with Alexandra. We also break it into shorter sections. It helps the students, I think.
Yeah, I agree for sure.
Yeah. Well, if there are no more questions, I'd like to say Chimagwech, and it's been great. I wish I could see you all on my screen, but I know you're there, and I wish you all the best of health and wellness.
We did have another question pop up here.
Okay, sure.
Asking, is there an example you could provide about the PI being a community member?
This does happen occasionally. It's not something that happens very often for a variety of reasons, some of which are going back to those institutional barriers. Our granting agencies until very recently have essentially not allowed First Nations, Inuit, or Métis communities to apply for research grants directly. That is just recently possible within Canadian Institutes of Health Research. But it's also a case of institutional capacity to manage research grants. That represents a burden for communities to take on. And so until some of those barriers are removed, the capacity, the institutional type of barriers, I don't think we'll see too much of it. On the other hand, I would absolutely encourage any community that wishes to embark on a research grant as the lead itself to do so. And I think it's part of what we need to do as academic investigators is to support that. So I hope that it will change, but it's not something that will happen overnight.
Great, thanks. There is another question that's asking, how are we going to deal with compensation versus research accounting?
That's another complex question, but an important one. Research accounting tends to view compensation levels as something that would be tied into formal Western education levels. So somebody with a PhD will tend to be compensated more than somebody with a bachelor's degree, and someone with no degree ends up at the bottom of the pile. So we need to work at changing that mindset and instead, having more respect for our knowledge keepers, our elders, and the value they bring to projects. And so I don't have an easy answer for it, except that I think collectively we need to work at convincing our research grants administration that the normal Western ways of compensation need to be re-examined. It's also something in a way that applies even to non-Indigenous community participants. So I hope that our CIHR SPORE networks, the strategy for patient-oriented research, it's taking on this task as well, and that non-Indigenous organization can support what we're trying to do.
Great. And maybe we'll end off with this last question here. It's asking, how key is it for the PI to be the main community contact? What about research coordinators and or other key research staff?
Well, again, there's probably no simple answer. I do like to have at least one active participant from a community, someone who is able and willing to sign on as a principal applicant from the community. Sometimes this is not always possible. The community lead may not be in a position to sign on like that. But in that case, it's important at least to have a active community participant, a co-trainee, a co-researcher. And that's the philosophy that we have with our Mio-Pimatuwin process here in Saskatchewan, that we try and pair up a community research associate, a community learner, with one of our academic learners in the academic system in the university.
Great. Well, thank you for your answers and for sharing those experiences and learnings with us as well. And of course, we would like to thank you, Malcolm, for sharing all your knowledge and your experiences with us, and for taking the time to go through this webinar journey with us. And also like to thank all the participants that have come and joined us on this journey as well. And we hope that you've picked up some knowledge pieces for your knowledge bundles, and that you'll be able to carry some learnings from these webinars with you in your professional and your personal lives. And thanks as well to the working group team here with that's helped put the webinar work together, and all the support of everyone who's participated in these webinars. And look forward to the next time we hear from all of you, and we'll make sure that we send out the recordings of the webinars and follow up with the infographic that we're developing. So I'll say miigwech to everyone, miigwech to Malcolm.
Yep.
And we'll be in touch with everyone soon.